Hello everyone, this is a D Pharmacy Pharmaceutics 1 class subject code 1.1T Unit 5. In this class, we are going to discuss sterilization of surgical dressings. Surgical dressings materials are generally cotton wool balls, gauze swabs, ribbon gauze, bandages, etc. Now, generally, uh, there are some stages that we follow during the sterilization of surgical dressings. These stages are: the first stage is packing or wrapping. Packing or wrapping the unsterilized surgical dressing into a suitable container or in a packaging by a packaging material. Generally, for this purpose, metal drums are used. These drums are perforated in order to facilitate the free flow of steam during the sterilization. The surgical dressings can also be wrapped with fabrics like nylon film bags or muslin cloth or calico cloth. The next stage is the loading of the materials into sterilizer. So the suitably packed surgical dressings materials are properly loaded into the sterilizer. The packing should be done in such a way so that it ensures the satisfactory steam penetration and the removal of the already present air in the sterilizer. So the pack should be kept as small as possible. The heavy material should not be sterilized along with the soft materials. The contents should be packed loosely and the space between the items should be parallel for ensuring a proper flow of steam inside the sterilizer. The next step is air replacement in sterilizer. After after completion of the loading, the sterilizer is closed and the air inside the sterilizer is replaced by steam by introducing the steam through an inlet channel. The next step is heating. The fabric pack surgical dressings are exposed for around 121 degrees centigrade, uh, nearby 30 to 45 minutes or about, uh, by the keeping the surgical dressings inside it. When surgical dressings are packed in a metallic drum, in that case we need a some longer time for sterilization. Means the time generally needed if you are packing or you are wrapping it in fabric materials, that is needed around 30 to 45 minutes. But if we are using metal drums, we need slightly longer time for ensuring effective sterilization. The next step is removal of contents. After switching off the sterilizer, the condense the steam present inside is generally condensed. The content of the sterilizer is then removed. The warm packs are not placed on a cold surface. It is done to avoid the condensation of steam into water, which may cause contamination through the porous wrappers. So immediately we do not keep the warm packets into a cold surface, because then water will be formed on the surface which can again lead to contamination. So that is the precaution you have to take during sterilization of surgical dressings. And the next step is after cooling of the wrapped surgical dressings, we have to level them, which will be definitely indicating the date of sterilization to prevent the overlong storage of a particular substance. So that's all about sterilization of surgical dressing. Uh, in my next class, I will be discussing sterilization of transfusion fluids. Thank you.